Hello and welcome to another session. Today we want to look at pharmacology in relation to body systems, and we want to pick the digestive system and look at that. How do drugs affect the digestive system? How can we use drugs to effect changes in the digestive system? So that's what we want to look at. And basic biology, we just want to recap. When we talk about the digestive system, we are referring to the system that begins in the lips or the mouth and moves on all the way through to the anus. So when we say the pharmacology of the digestive system, we are basically looking at this system from the mouth to the anus. The focus of this lecture or lesson will be on the stomach and the movement of the system. So we know that from the mouth, we go through the esophagus and we meet the stomach. The peculiar thing about the stomach is the acid that is found in the stomach. This lecture will focus on how we will affect the acid, and there are 5 ways we can affect the acid. We can affect the acid through the production. We can affect the acid through the secretion. We can neutralize the acid directly. We can also form a barrier between the acid and the mucosal wall of our GI tract. And the 5th way is a combination of all of these. So we'll be looking at that. The next thing we'll be looking at is movement. We know that the peristaltic movement or process is how things move through your GI tract. We can increase or speed up this movement. We can also slow down this movement. And these movements are forward usually, but we can also reverse the movement backwards by inducing vomiting, or we can slow down a movement that is coming backwards. And we can even also affect involuntary movement of these smooth muscles. So we'll be looking at movement and we'll be looking at the acid. So that is what the lesson pharmacology of the digestive system will be looking at. So let's begin by looking at drugs that will affect the acid production. All right. So as stated, we will look at 5 drugs, groups of drugs, and that's what we're going to be focusing on. Let's start with the first group, the H2 receptor blockers or the H2 receptor antagonists. These drugs are involved with the production and ultimate secretion of the HCl. They are identified as the thydines. So in their name, you see thydine. So cimetidine, ranitidine, nizatidine, famotidine. Normally, the thydines help us identify the H2 receptor blockers or antagonists. Now, we know that when it comes to acid production, it occurs in a specialized cell in the GI mucosa wall known as the parietal cell. In our structure, we have the parietal cell, which so the parietal cells are where the acid is produced. 3 raw materials are involved in the acid production: gastrin, acetylcholine, and histamine. A combination of these 3 is what results in the acid production. So these 3 ingredients, if you like, mix together, work together, activate the parietal cells to secrete the HCl. They must all three be available for HCl to be secreted. So when we put in an H2 receptor blocker, what we do is that we interfere with one of the raw materials. And in doing so, we prevent the secretion, production and secretion of the HCl. In other words, H2 receptor blockers work by reducing the production of the HCl, the stomach acid, and by reducing secretion ultimately, because once production is decreased, the amount that to be secreted is also decreased. How do they work? Histamine has two receptors, histamine H1 receptor, histamine H2 receptors. On our parietal cells, we have histamine H2 receptors, and when we put in the blocker, it inhibits the receptor, thus preventing histamine from acting on the receptor. So there is a competition between our blocker and histamine. And once our blocker blocks this H2 receptor, the receptor is not available for histamine, so that the production of acid and ultimately the secretion is affected. It's been estimated that this, when we put in an H2 blocker, it's usually able to block about 50% of production and hence 50% of secretion. Thus, these drugs are able to reduce our acids that are secreted by about 50% and therefore helpful for acid-related problems. So what are we saying? We are saying that H2 receptor blockers or antagonists work by causing the reduction in the amount of acid, HCl, that are produced in the parietal cells, thus resulting in a decrease in the amount of acid that is secreted into the lumen of our stomach. And it does so by blocking the action of histamine at the histamine H2 receptors that are found on the parietal cells. Because histamine works together with gastrin and acetylcholine for the production of the acid, once we are able to inhibit histamine, gastrin is automatically inhibited and less acid is produced. So these are the tidings, the H2 receptor blockers. And various examples, as we stated earlier, cimetidine, ranitidine, famotidine, and nizatidine being identified by the tidine. How do we use these drugs? H2 receptor blockers are commonly used for acid-related problems. We use them either for prevention or for treatment. Now, we can use it to treat gastritis or prevent gastritis. We can use it to manage peptic ulcer or prevent peptic ulcer. We can use it for duodenal ulcer prevention or treatment, acid reflux, and for GERD, which is a chronic form of acid reflux. So you see that all these are acid-related problems, and we can use our H2 receptor blockers to help us. All right. Gastritis, inflammation of the stomach, in that order. All right. Maybe a quick word on peptic ulcer and duodenal ulcer. Peptic ulcer is stomach ulcer, ulcer that is found in the stomach, and duodenal ulcer is ulcer that is found in the duodenum, the early part of the small intestine. These two are usually exhibit unique characteristics. So, for example, when you have duodenal ulcer and you eat, the pain associated with the ulcer usually goes down. But when you have stomach ulcer and you eat, the pain is aggravated. In both instances, when you are hungry, the pain may be there. But you notice that when you are hungry and there is pain, you eat and the pain subsides a little bit, you are probably looking at duodenal ulcer. But if you eat and the pain becomes worse, you are probably looking at peptic ulcer. And in both instances, we can use tidings, H2 receptor blockers, to help our patients. What are some side effects associated with the use of H2 receptor blockers? First of all, we want to look at the GI tract side effects. It could be diarrhea, it could be constipation. It's also known that these receptors, H2 receptors, are not only found on the parietal cells, but are also found in other parts of the body. The CNS, central nervous system, has some of these receptors. And when these receptors are activated, they may cause side effects like dizziness, drowsiness, headaches, confusion, or even sometimes hallucination. And if it is a cardio or the heart H2 receptors that are activated, they could cause hypotension or they could cause irregular heartbeats, arrhythmias. And it's all the same activity of blocking histamine on H2 receptors. Cimetidine, the first member that was identified, has been known to cause in male or men impotence and gynecomastia. Now, this, of course, was one of the side effects that kept men from using the medication, because once they used the medication, there was the increase in impotence among some of them, and some developed the breast, as shown in the picture. So this is peculiar to cimetidine, and we should note that. It doesn't occur with the other H2 receptor blockers, but cimetidine, it usually occurs with cimetidine. Great. Now, here's some advice you want to give your patient who is going to go on H2 receptor blockers. One, you want them to take the medication at least 30 minutes before food, advisably 1 hour before food. Why? Because we know that the drug is going to act on production. And again, another point we want to note is that the acid in the stomach is released or secreted based on demand. It's not always there. It's not stored for future use. Once demand is there, it comes in. So we want to make sure that we are reducing production and hence secretion before we eat. And so that's why they advise 30 minutes to 60 minutes before food, you take your medication so that we can reduce the acid. We also don't want to overeat. 2 reasons. Overeating stretches the GI tract, and if there are ulcers or inflammations there, that will make it worse. 2, overeating stimulates the release of more acids or the secretion of more acid, so we don't want to do that. Stress is also another indicator for release of acid, so you want to advise your patient to reduce stress as much as possible. Smoking also induces acids and affects, in fact, every part of the system, so we don't want the person to smoke, so we advise no smoking. Insects are irritants of your GI tract, so we want your patient to avoid insects. So no insects. All right. When we say side effects, basically what we mean, and I just want to explain those terms, a side effect is typically an effect that we don't desire, we don't want when we are given a drug or a medicine, but comes with the medicine in some patients. An adverse effect, on the other hand, is something we do not expect, but it can occur with the use of the drug. In other words, side effects are expected, typical, undesirable, but expected. However, adverse effects are not expected. So I just thought I should put that in so that we could look at it. And adverse effects can be quite severe. Sometimes they are mild, but you can have severe adverse effects that requires medical attention immediately. All right. Now, when it comes to the tannins or the H2 receptor blockers, it's been noted that they have drug-drug interactions with various drugs, especially cimetidine, famotidine, ranitidine. And this is simply because the enzyme, the cytochrome P450 enzymes responsible for working on these drugs are known to be inhibited. And we also know that the cytochrome P450 enzymes do not work only on H2 receptor blockers, but on various drugs. So by inhibiting the activity of these liver enzymes, these H2 receptor blockers are able to slow down the activity of these enzymes. In other words, they are able to slow down the metabolism of other medications, which are metabolized by these same enzymes. And in slowing down that metabolism, it leads possibly to an increased concentration of the other agent, the other drug. That increased concentration will result in toxicity. So, for example, if you put cimetidine together with phenytoin into a patient, you have to be monitoring the phenytoin concentrations simply because both of them are metabolized by the same enzyme. But the presence of the cimetidine is going to inhibit that enzyme, and it will result in higher concentrations of your phenytoin, which, if not monitored, can result in side effects like or result in side effects like seizures, etc. The other member of these H2 receptor blockers, nizatidine, seems not to do this inhibition of liver enzymes. Therefore, it seems that for that one, you don't necessarily need to be monitoring and probably adjust the dose of the other drug. It doesn't seem to have that inhibiting effect. So its interaction, drug-drug interaction, is minimal or probably non-existent. But when it comes to cimetidine, famotidine, ranitidine, you should always be monitoring. Especially if, I mean, there are two ways we are looking at it. We've just looked at how it's slowing down metabolism. There are certain drugs that are actually also eliminated. The elimination is through the metabolism in the liver. And for such drugs also, the same applies, where you have an increased concentration because the liver is not able to metabolize as it's supposed because the enzymes are being inhibited. All right, so that is the first way we can affect our acid by affecting production through inhibiting of the activity of histamine, resulting ultimately in decreased secretion of the acid. That's all that we will say for today. When we meet in our next lesson, we will talk about the next group, the proton pump inhibitors. Thank you very much. The Lord bless us all. Don't forget to subscribe to the channel so that you get to know what is going on as we continue our study. All the best.